this one off with some chuckles. Well, hi, and welcome back to Broken and Brilliant. I'm Carrie O'Toole with Carrie O'Toole Ministries. I'm joined by my co-host, Jenny Presti.
Yep.
Your name is so much easier to pronounce. Just have to say.
Yes, but you probably couldn't spell it, so.
P-R-E-S. Is it two S's?
Mm-hmm.
And two D's?
No, just
one D and two E's.
Yes.
Okay. Gotcha. The one D. Okay. And we're joined again by Megan Swenson. Welcome.
Thank you.
Well, last time when you were on with us, Megan, you were talking a little bit about working with your nonprofit. And just describe that one more time so people know who you are, what your title is, and what you do.
So I'm a licensed professional counselor as well as a licensed addiction counselor. And I work with nonprofit mental health and nonprofit substance abuse.
Okay. You know, we were talking a little bit about how trauma sometimes can lead us down a path that can lead to addiction.
Mm-hmm. Mm-hmm.
Numbing pain that you don't want to deal with, that type of stuff you don't know how to deal with, maybe.
Mm-hmm.
What are some warning signs that somebody might be headed for an addiction?
Okay, that's a really good question. Some of the warning signs are looking for drastic behavior changes in someone. So mood, like more depression, more anxiety, a lot of isolation.
Mm-hmm.
So a lot of those behavior changes that really cannot be described other ways. A lot of manipulation or lying, hiding stuff. If you're finding bottles or paraphernalia around the house that's hidden, that's obviously a warning sign to look out for.
Missing money,
Missing money, yep. Missing money. There's a lot of different behaviors, but the big thing is going to be the behavior change and the mood.
Okay.
Okay. Yeah, and we were talking just a little bit off camera about how this can be starting, you know, as young as elementary school and middle school.
Yes, especially with marijuana, now that it's legal in Colorado. In Colorado.
Yeah, let's talk about that for a minute, shall we? Let's push a little button here and see if we can provoke anything in this one.
People love this conversation right here.
Yeah, well, you either love it or you hate it or something. So, marijuana is legal in Colorado, according to Colorado state law. What does that mean?
That means for medicinal use, they can definitely get it. And then certain shops, there's a few shops right now that you can walk in and purchase it without having the red card, medical card. There's very few of those. They're going to be opening up more. That's what that means.
And so let's talk about marijuana for a minute because, you know, I think culturally, it's sort of like old fogies like me believe that this is a really harmful, it's the gateway drug, we're all paranoid, and yet there's a younger generation who are like, it's just like drinking, it's no different than drinking, and we do fine with drinking. Of course, you work in an alcohol rehab facility, so maybe we're not doing so fine with drinking, but what does marijuana do? What's the problem with it, or is there a problem with it?
There's a lot of different problems with it. It can create anxiety disorders, and so people that were coming in for treatment for mental health that have anxiety disorders, one of the first questions I ask them are you using marijuana in any form, smoking or edibles? Because that's a huge indication of possible drug-induced anxiety disorder.
I've never heard of that.
Yeah.
No, I didn't either.
Yes.
Wow.
Yep.
Well, I remember hearing on the news not too long ago that there was a student who had taken an edible, eaten an edible, I don't know how you say that, and took a dive off of a balcony. And I thought, I wonder if that was anxiety produced, you know?
Could be.
Whatever might have happened.
In certain THC levels, when you get to like the high amounts of THC, which isn't really controlled, you know, we're not controlling a whole lot of it, especially in the edible form. Those high amounts of THC can cause delusions and hallucinations, and people will react erratically like that.
Which seems counter-logical because you'd think marijuana is the ultimate chill out. You know, people don't care. They don't, you know. And so it's not a consequence you expect.
Right.
From something like that.
Yes. And there's different strains, different forms, and there's a whole lot of technical stuff that you can get into with it. But what I'm seeing where I work is people are coming in with anxiety disorders because of marijuana. Drug induced. They started when they were really young, and they didn't have anxiety before that, and so that kind of rules out a possible anxiety disorder. If they treat the marijuana use, the anxiety disorder will improve.
So they're not even coming in for an addiction.
Right.
They're coming in for an anxiety disorder that is created through this.
Right.
Interesting.
So that's kind of in the mental health. There's a lot of other stuff that we can go into with how it functions in the brain, and it gets really technical. But with the medical health of it, marijuana burns 5 times hotter in your lungs than a normal cigarette does. And so your soft tissues of your lungs are really, really getting destroyed.
If you're smoking.
If you're smoking it. And so clients that I have, if they're not interested in quitting or cutting back or addressing their marijuana use, I will recommend for them to use edible form rather than smoking for harm reduction purposes. Just because it's so damaging.
Yeah.
So
Just interesting. I mean, these aren't things you talk about too often. So,
Right.
And yet you live it every day.
Yes.
This is what you see every day. What would you say as far as clientele? Do you have more people who are addicted to alcohol, more people who are addicted to marijuana or harder drugs? Is it a cross section?
Colorado's number 2 in the nation for prescription opiate abuse. And so we do see a lot of the prescription opiates, like Percocet, Vicodin. We do see a lot of that. Number 2 in the nation, yeah. So we do have a high population of that. We have a high population of meth. We have a high population of alcohol. But with those, oftentimes we see marijuana on top of these other addictions. It's like a secondary addiction, and clients don't see it as an issue. They see this opiate addiction as their issue, not marijuana. And so the way you treat it's a little different.
So, and what about the difference between children, teenagers using marijuana versus an adult?
So children and teenagers, your brain's developing. So you do not want to mess with that, until age 25, 26. You really want to stay substance free, because otherwise you're going to have a lot of learning disorders, behavior disorders. Anxiety is going to be created, but in adulthood too, anxiety can be created and you can still do damage. I don't want to say, if you're going to use as an adult. Don't use it all is my recommendation. But there's a lot more damage that can take place in developmental years of your brain. So
Now, would you, from your professional experience, do you see, I mean, culturally we find it acceptable to have, I know most people that will have a few times a week a glass of wine with dinner, you know, and that's something that they can enjoy, and it doesn't go any further than that, or social occasions, they have drinks. Do you find that in the same category as somebody who would recreationally, socially enjoy a joint? I mean, is marijuana something that you can casually dip in and out of the same way you can casually dip? Some people, alcohol, casual and brief is fine. It doesn't. Do you find that as the same category, or do you, on your experience, find that no, they're two very different?
I think everything's okay in moderation, but being careful that, if you smoke a joint and get behind a car, you use it, recreationally, and you get behind a car, you're still at risk of getting a DUI, especially in the state of Colorado.
Or killing somebody.
Or killing someone.
Yeah, exactly.
What happens when someone's driving with marijuana is you have your peripheral vision, and what happens is it encloses. And so when you're driving, you don't have a lot of this on the side. You only have it right here. So you're really restricted, and it's really dangerous. I mean, you're impaired is what that is. And so that's the biggest thing that we're seeing in Colorado is how to measure that. They're still trying to figure out the different levels and blood testing and hair follicle testing, whatever that is. So they're still trying to figure that out, but all in all, you're impaired driving.
Okay.
As far as like using in moderation, I do have clients that report they use once a month and it's fine. And it might be to help them just relax, like it's kind of like a muscle relaxer. They help calm them down. So I do have those clients that I'm not as concerned about. It's the everyday users that are smoking. And so even the clients that use once a month or less, I still recommend edible forms if they're going to use it, just because of the damage on the lungs again. Yep.
So interesting. I don't know why that's funny to me, but when it's not your world, it's like,
that makes sense.
That. Okay, so if I'm going to smoke pot, I should actually eat it. Okay.
But be careful with eating. Be careful with it, because you don't know how much THC is in it. So, people
don't
that
eat
are
the
buying
whole pan of brownies.
Exactly. Yes, don't do that. Whereas you would if there wasn't THC in it, right?
Right. Well, what's so funny, we have a joke in our family because whenever we have brownies, my husband always says to my daughter, Katie, I'm going to eat all the brownies. And she's like, no.
Yes.
So I'm like, okay, well, especially if we have
Right.
edibles, we will
Yes.
Dad should not be eating all the brownies.
Yes.
Well,
It'd be very dangerous.
Don't share them with the kids either. But, oh my
What's
goodness.
really exciting in some of the research, because in the medical marijuana field, that they're figuring out how to take the THC out and
Right.
left with just the CBD, and there are forms of gum and oils and hemp oils and stuff, and because of the chronic pain I've had, there's things that I've tried and experimented, and they're still pretty expensive, but so it's the
So
benefit.
they take the drug part of it out.
Any psychotropic effects are
high.
gone. Yeah, the high, but you can still benefit from the and so there is
medical.
help on the horizon. I think for people that do benefit medically from it, but that perhaps don't need the other things. So
Yeah, would like to stay within their
Right.
right mind while they're recovering.
yeah,
And when you mentioned chronic pain, that's another whole piece of this is people that are using the medical form of marijuana, a lot of them are using it for pain reasons.
yeah,
Cancer, whatever it is that's connected to it. But with pain, when we deal with chronic pain, so that's kind of identifying pain that's lasted 3 to 6 months or longer. Anything before that is considered acute pain, so like a new injury. Most of the healing of your tissues and your bones, whatever the tissue damage that's going on, has healed within those first 0 to 6 months. And so the pain piece is, 6 months plus. And when we work with that, the research that's out there right now is saying that the primarily big thing with that is emotions and cognitions connected to your pain, and not so much the physical sensation. So even though you experience the pain physically in your body, it's driven by emotions, stress levels, and cognition, so your thought processes. So if you're telling yourself, I'm never going to get better, this is never going to go away, that's going to drive your pain more. And so when we work with patients with chronic pain, marijuana, they oftentimes will choose marijuana over an opiate, which, edible form again, I would recommend. But with that, we also have to address the emotions and cognitions connected to it, because that's the majority of what's happening in chronic pain, because your body is healed as much as it's going to heal. And so what are the stressors connected to it? What are your experiences connected to it? What is that saying? There's fear.
Here you're back to trauma.
Back to trauma, exactly. Exactly.
Something happened
Exactly.
that your body is not forgetting. And
Right.
you're trying to push it away. You don't want to go there because it was painful.
yeah.
But in doing that, you're actually preventing yourself from healing, so the pain continues.
Right.
It's like you're trying to prevent an emotional pain, but you're actually causing a physical pain.
And that's my question for a lot of my clients are, what are you medicating? Are you medicating your emotional pain or your actual physical pain at this point?
Yeah.
And that's a huge question that I have for them. And oftentimes they'll say, both.
Yeah.
Probably my emotional more. Because I'll ask them, where do you carry your stress? Like I carry mine in my shoulders and my back. And that's where my pain is, right? And so I get tense, and that's what I need to focus on is, how do I release my stress? How do I decrease my stress levels so that my pain in my back can relax as well? So it's all interconnected. And pain, and some people don't connect the two, and I didn't until I learned a lot of this information about chronic pain. All pain is created by your brain. So pain does not exist in your body until your brain says it does. And so when we look at that, we can control our thoughts and our emotions for the most part, so we should be able to control our pain. It's all interconnected.
And as somebody who has struggled with that, I have spoken to other people who struggled with chronic pain, and it's always a little bit of a for some people a gray area, because when you experience chronic pain, it can be you can be made to feel it's all in your head.
Right.
And so,
Right.
trying to get somebody to take the leap of the issues are in your tissues kind of thing. It's not, so I'm not saying it's in your head, but you've got some things.
Right.
Do you find that difficult to help people?
Yes.
I'm not saying it's all in your head, but there's some things we need to, so rather validating their pain, you're not trying to invalidate it.
Right.
Or say it doesn't really
Or say
It doesn't
doesn't
exist.
exist.
Exactly.
If you'd just quit thinking about it, it
Right.
wouldn't.
It's a lot deeper than that.
Yeah.
And what you're experiencing in your body is accurate. It's real. It's there. But where it's coming from is your brain. And so we need to really focus on the stress, the emotions, the depression, anxiety, whatever else is going on related to your pain, and those thoughts again, because when we focus on those areas, your pain will decrease. And that's what we're seeing is a lot of times people are able to take control of their pain. There's a neuroscientist from Australia, He's phenomenal, but he thinks you can live a pain-free life, and that pain is an illusion 100% of the time. And he's done a lot of research on it. It's really interesting, and he has a lot of great arguments and great points. And I also struggle with chronic pain, so it's one of those things where I was like, yeah, right. I don't believe this. He's full of it.
Yeah.
But the more and more I listen and research and study this information, there's a lot of good stuff out there, and talking about stress management, mindfulness, meditation, exercise, ways to deal with the emotional piece of it, and showing that it is helping the physical piece. And that's all interconnected.
Let's talk for just a few minutes about what to do if somebody in your family, somebody that you love, either your children or a spouse or, somebody you're dating, is you can see these symptoms.
Yeah.
You see something's going on here. You know that there's an addiction forming or it's full-blown. What do you do?
That's a really good question. Yes. So my first thing is safety. I always look at the safety piece of it. If they're doing really harmful behaviors like driving intoxicated, if they start cutting themselves when they're intoxicated or high, whatever that is.
Mom's putting the kids in the back of the car.
Right. So we gotta look at safety first. When that's happening, I always encourage people to get police involvement just because of that risk. Other ways that you can help people are helping them gain connected detox services. Oftentimes, detox is a first step before you go into treatment, because unless you get that detox, the risk, the chances of successfully going through the treatments are lower, because your body needs to go through that process first. Otherwise, it's going to continue to relapse, because it's a lot harder to do treatment when you're constantly using. Your brain isn't not as involved in it. So detox is a good first step for that. There's a lot of different detox units out there in the Colorado, Denver metro area. Rappahannock has a ton. West Pines has a medical detox for alcohol. Alcohol is one of those ones that's really dangerous detox. You can die from withdrawal. Seizures happen often.
So you don't want to do this by yourself.
Right. And yeah, you just want to get the help, the support. So there's multiple different detoxes that you can do.
The way they show it on TV, it looks like who in their right mind would ever put themselves through detox? I mean, it would be better just to stay a drug addict the rest of your life than to go through detox, because it just looks miserable.
It is. So
how do you prepare somebody for this? Or what if they don't want to go because they're terrified of the detox?
Right. And that's the first step. A lot of times they are very fearful of that detox piece of it, and having to have those negative symptoms of the withdrawal symptoms. And so a lot of it's going to be educating them on what to expect, what to bring, how to get comfortable. There's medications that can help with that. For like opiates, there's clonidine patches to help with some of that. Alcohol withdrawal, they usually will use a benzodiazepine to help with some of the detox. But it's monitored and controlled so that it's being administered by a professional and not just themselves. And the staff that does work in detox are trained to know what to look for to keep you safe. So it's a really good opportunity for people to get through that initial phase so that they can get into treatment and start the process of healing.
So what if your loved one does not want to go to detox?
Unfortunately, you can't make anyone go. It has to be their time, their decision. Now, again, if they're engaging in illegal activities or safety issues or things like that, you can always report it to the police and have that type of involvement and intervention. But sometimes that's not enough either. People will lose everything. Hitting rock bottom is kind of that phrase that they talk about with addiction. And, I thought some of my clients that have hit rock bottom in my eyes have been rock bottom was not their rock bottom. It was even lower than what I thought. Yeah.
Wow.
And basically where they lose everything. And even then more than that. So it all depends on the person and what is their rock bottom and what is going to motivate them to go in and get that treatment and seek help on their own. Because you have internal motivation, you have external motivation. It has to come internal. So
now I do know, let's talk a little bit about enabling and what are things that people do when there's an addict in their midst that actually contribute to it or make it worse or cause this person to not have to go in and seek treatment because you're actually helping them stay addicted. What are those behaviors? What do people do?
So addicts and alcoholics are really good at manipulating people into helping them with their addiction. They will minimize. They'll get you to buy them alcohol or drugs or just drop them off here or give, rides is enabling for some people. Allowing to do rides, giving money is enabling behavior for a lot of addicts and alcoholics. To seeing them hurt themselves, right, and not kind of setting those healthy boundaries is enabling behavior. So, and it's really harmful. But knowing how to balance like healthy boundaries and love it's tricky, and it depends on the family member and what they're comfortable with and. The communication and really getting support because
is there help for family members whose the addict will not get help?
Yes.
Where can they go?
Al-Anon is a great resource. So you have AA and then you have Al-Anon. Al-Anon is a family support for people that have family members that are addicted. And so it's a great support for family members to really understand what is addiction, how has it helped other people get through this phase of their life,
Right.
And what to do, what not to do.
Because some people may not be aware that just in the similar recovery for alcoholics and that there is damage and recovery for people who have been around it.
Yes.
For children, for partners, for other family members, that you develop behaviors. And it, I don't know if you, as a professional, you would go as far as to call it a trauma, but it can be.
Yes, it is.
And you develop behaviors to cope. And, if you're not aware of that, if you don't know how to deal with that, then it ruins your life too.
You made a really good point. Addiction affects everybody. So not just the addict or alcoholic, but all the people surrounding that person's life. And I don't know one person that does not have addiction impacting their life in one way or another.
Well, and right now we're basically talking about drugs and alcohol. And those are not the only addictions.
They're not the only addictions.
These are the ones you're specializing in right now. But if you can imagine how many of us either have been addicted, have lived with an addict, who grew up in an addictive home, who had their best friend's dad was an addict, whatever. Everybody is impacted by this, and these are two addictions.
Yeah.
And addictions what is an addiction? Let's just talk about that for just a second. What is an addiction?
It's anything that can take control of your life. That's how I kind of describe it. Food, exercise, sex. Those are all different addictions. I mean, I can keep going. There's so many different addictions out there. Nicotine, right? Tobacco. That's one that we don't really look at as much. Like, we know it's an addiction, but we don't focus on it.
Well, I think the food one especially too, because there are some socially acceptable addictions.
Right.
Sugar is a huge one. Caffeine, right. Absolutely. And sometimes we kind of joke about it. I remember I was leading a small group one time, and one of the women was talking about a hard thing she was going through, and they all started joking about, let's go do some retail therapy after this.
Right.
And the thing was, they didn't have the money. They knew they didn't have the money. They knew they shouldn't be going, but it was like, I've got to go buy something to make me feel better. And I've known families that have gone under. And they call it retail therapy with a smile, and let's go to Starbucks and have a latte. And, oh my goodness, you're addicted. Because try to take it away.
Right. Yep.
And see how you feel.
Work addictions, shopping addictions, kind of like you're saying, it's all over. And it does take control of your life. And your functioning. So you got to look at your level of functioning. When it's poor because of this issue, some type of addiction in your life, then that that there's a problem.
Your relationships are suffering.
Relationships, financial, work. There's so many different areas that you got to look at. And so what I focus on is the substance piece of it, but there's a lot of other stuff. And there are oftentimes multiple addictions with one person.
Right.
Not just one, multiples.
And so as you're dealing with somebody who comes in, say, for alcohol treatment, you kind of have to go through the checklist for all the other things, too, because you need to find out, are there other chemicals involved? Are there other behaviors involved?
Right.
Is there self-harm involved?
Cutting's an addiction for some people.
Right.
Yep.
Let's talk just for a second about cutting.
Okay.
This is an interesting phenomenon. A lot of people, I think, in an older generation don't really get this.
Yes.
but it's huge. And it's not just girls.
Right.
It's boys too.
Right.
Why would somebody cut?
It's an emotional release. They actually get a chemical release in their brain that's a feel-good chemical. And oftentimes it's not for suicide, it's not for attention. It's because they're just so tight, like overwhelmed with whatever's going on in their life that they don't know how else to release it, and that's their way of release. And it's not just on their hands or their arms.
And so when they're cutting, that seems very painful to me.
Right.
So I don't understand how is causing pain, how does that feel good?
For them, it feels good. It's that release. Seeing the blood is a release. And so if they're in treatment and they stop cutting and then they have any type of blood, another injury, it's a similar thing. They have that similar chemical reaction in their brain. It's very interesting. But the thing is with looking for someone that cuts and does self-harm behaviors, it's not just cutting, it's burning. There's all these different behaviors that we gotta look for. And now it's becoming almost socially acceptable in high schools and middle schools with teenage girls and boys. And then another thing too is they cut in all different areas. I know clients that have cutting in between their legs because they don't want to show it. It's not something they want.
So they hide it.
They hide it, and that's the best way they can find to hide it.
Is there a specific type of trauma that goes with that? Because I'm trying to imagine what relationship would trigger, the sight of blood with pleasure. I mean, is there a specific type, or is it just, it's how they've...
It's kind of just developed.
Do most people learn it from somebody else?
I would say a lot of them do.
So they're teaching each other at school, maybe.
Yeah.
Wow.
Yep. And there are websites, and unfortunately there are a lot of websites on how to do this stuff, and it's sad.
Well, and I would imagine it can be dangerous because
Very
sometimes
dangerous.
you don't know how far how deep you're cutting, or
and if
how
you're
often,
using other substances,
or if you're the article that you're using to cut with is unsanitary, you can get an infection. There's all different types of things that can go wrong with that. But wow, well, woo! This, do you come home? Are you drained every day, or does this invigorate you? How do you deal with people who are really, they're at rock bottom? How do you deal with that every day?
Even having client, back to client, like back-to-back stuff going on in the day, I really have to take breaks. And really utilizing my own self-care, because it can get really hard some days, especially when there's a lot of emotional stuff going on or trauma. It's really not getting too much into their story, but listening to it from a distance in a way. Because if you're in the story, then you're in their trauma. And vicarious trauma for therapists is huge, secondary trauma. And there's been times that I have brought it home, and I'm human. But then finding support, so having my own support system, having a supervisor that I trust that I can call or talk to, exercise
So you're not
is great.
breaking confidentiality, but you
Right.
have somebody who's safe that you can discuss a case with if it's really bothering you.
Right, exactly. Yep.
So you have to find ways to let it go, because I could almost imagine that addiction counselors would be at risk for addiction.
For addiction, yeah. There are quite a few of them. And it does put you at risk. So really utilizing your own self-care, what that looks like.
And just being aware that you're constantly at risk.
Yep.
So taking preventative measures and making sure you're checking yourself. And wow, that's great.
Yeah.
Well, Megan, this has been so interesting, and it's been so great to see you. And
Yes, I know.
It's fun talking to you here as a professional instead of my student buddy that we're sitting in the back of the classroom. Giggling. Now we're giggling on video. But thank you. Thank you so much for joining us. It's been so interesting. And Jenny, thank you.
Thank you.
Again for being here.
Thank you for having me.
And thanks you all for joining us, and we'll see you next time here on Broken and Brilliant.